Welcome, everybody. My name is Julianne Frayne. I'm the Research and Programs Coordinator here at the Banff Sport Medicine Foundation. And with me today is Dr. Mark Hurd, Orthopaedic Surgeon at the Banff Sport Medicine Clinic, and also the Chairperson of our Foundation Board. So thank you for joining me here today, Dr. Hurd.
You're welcome.
And I thought maybe we could start by just quickly talking about the mission and the vision of the foundation.
Thanks, Julianne. Well, our foundation that has been formed about 2 to 3 years ago and finally up and running, its mission statement is to prevent, treat, rehabilitate, and do research in sport medicine injuries. And I think it's important that people understand it is the full spectrum of care that is the underlying mission of the foundation. Starting with stepping back and looking at who's at risk of injury, who's at risk of re-injury, how do we prevent injury? Are there some programs that we can use in injury prevention? To looking at what are we doing in the OR, question what we're doing in the OR. Are there advances in techniques that we can improve in the OR? To how are we rehabilitating these people? Are we sending them back to sport too early, too late? How are we dealing with the psychology of sport? All of those aspects are critical when looking at a whole person. And then finally, how do we tie it together? How do we tie it together with research? And how do we tie it together with education? That's sort of the package of the mission statement. The vision is to actually deliver on that. So the division, we've always had 3 pillars in our foundation. And one pillar is the clinical care, actually assessing, treating, and rehabilitating injury. So that's always been there. But the education part of educating, not only from a surgical perspective, our fellows, our residents, our medical students, our emerge students and family practitioner students coming through, but on a broader spectrum, the physiotherapists, the occupational therapists, the orthotists, the sports psych, that whole education piece is going to be integrated in what we're doing with our foundation. And then lastly is the research piece, being able to have good data collection, being able to publish and write articles and do podcasts and do seminars in the community, taking the research and then applying it. So that in essence is our mission and vision of the Banff Sport Medicine Foundation.
You mentioned sport injuries as well. In terms of the patient demographics here in the Bow Valley, is it just sport injuries that we see primarily, or are there other ranges of injuries that we also look at through the clinic?
It's a great question. Really, musculoskeletal medicine is motion. And that is a critical part of human health, being able to move. So you're absolutely right. Our treatment spectrum is from the youth trying to learn to walk, trying to learn to play soccer properly, try to do it without getting injured, whether it be competitive sport, recreational sport, or just motion, to the other end of the spectrum, the elderly who want to just get out and hike and be Neanderthals and scramble and be that part of the community. What can we help in the prevention and treatment for that population? And then everything in between, from just family activities of the classic one out here is the whole family going out for a cross-country ski or a downhill ski, or a hike or a bike or a canoe down the Bow River. All that in my mind is under the umbrella of sport medicine. The age group that we see most of are people in their very active age, that 15 to 30-year-old age group, where they are participating and getting injured at sport, is probably the typical patient we see. But as you know, we have skiers skiing well into their 60s, 70s, 80s, and some into their 90s. And they would be clientele, but lesser so. What we also look at is what is the potential for that person over a lifetime. An injury when someone is 15 that has a negative consequence can cause arthritis in the knee or the shoulder or the ankle, and really change their life for multiple years, and can adversely affect their ability to move. So we definitely pay a special attention to youth, mostly because of their potential. The other thing is youth has a higher potential to re-injure. They tend to go back out and hurt themselves again. And we know with our big workhorse is the anterior cruciate ligament. We know that when you injure the anterior cruciate ligament, it's often the second, third, and fourth injury that does the debilitating damage that causes arthritis in the knee. So we do focus and spend special attention on that youth group.
Yes, and like you said, I imagine, as you mentioned, secondary injury prevention is also probably extremely important in that group, as you say.
Yeah, it just, if you look at human behavior, as we get older, we're generally more willing to say, yes, I'm willing to stay off the soccer pitch and ride my bike. Whereas a 15-year-old, as soon as they feel better, they're out playing soccer again. So we do see that countlessly, the young people just having that secondary injury. The emphasis on rehab is becoming bigger and bigger. Whether you have surgery or just have injury, the knowledge that we're gaining over the last several years in rehabilitation and in how long it takes to recover is growing and growing. We have a great collaboration with the University of Calgary Department of Kinesiology, and have done multiple studies with them on recovery and rehab, and are realizing that injury takes 1 to 2 years to recover from, as does surgery. It's not 6 weeks later after my sprained ankle, I'm 100%. It is months to years. And that's one of the fascinating things about delving into research and looking at these questions that helps guide us in giving scientifically based advice.
Yeah, you bring up a really good point there, that integration between what we can learn from research, because I'm sure it's probably a surprise to a lot of people to hear that actually not just injury but recovery from surgery could potentially take that long. So getting that that message out there to patients, I think is a really important message as well, that we learn from actually doing evidence-based research, and having that integration with the things that we do, for example, at the foundation, research, and integrating that into education and patient care is a really important point.
Yeah, and I can't emphasize how disseminating that knowledge is important. It's interesting, that whole topic of return to sport is gradually across the whole world realizing that we are not fully recovered at 6 months or a year, and it does take longer than that. And with the internet, with the just sharing of knowledge that is exploding in our lifetimes, it's interesting to see the behaviors change from 20 years ago. 20 years ago, it used to be you'd kind of be cocky and say, oh, I got my skier back on skis at 6 weeks. Look at how great we were. And then we'd have a bunch fail and go, oh, but it is nice to see the whole community responding to evidence-based medicine and changing their practices in evidence-based medicine. And I think we're proud at the Banff Sport Medicine Foundation. Our research and our publications are being utilized around the world, and it is changing injury rates and the way we look at all of these injuries, rehabilitation, that whole spectrum. So we're quite proud of disseminating that knowledge. There are so many topics, such as, is it appropriate for a certain athlete with a certain body type, flexibility, core strength, shape of their knee, shape of their bony architecture. We are now looking at many facets on return to sport that are more than just hop tests, jump tests, and can you run down the hall? It's an evolving field.
In what ways could you see some us expanding into being able to answer some of those questions and maybe develop some tools to kind of assess that? Where do you think we could go if money was no object?
Yeah, I think I'll answer that question by going after the pillars. From an education point of view, yes, we can improve our rehab protocols, our videos, all of those sorts of things, but we can also look at a bigger picture. The Bow Valley is a wonderful destination for education, and we would love to be an incubator site in medical, rehabilitation, prevention, education, and draw in, whether it's virtually or physically, people for education. We've kind of been a one-on-one, teaching a fellow, teaching a resident, teaching a physiotherapist. I think we can hit a broader audience with our education in the future. From a clinical side, it's endless what we can do. Being involved in randomized trials, being involved in clinical research such as treatment of articular cartilage injury, the use of robotics and artificial intelligence in the operating room. There's just so many aspects that we have a great ability to ask questions and randomize and study. And then from a research perspective, I think we can definitely expand on what we're doing, broaden our base of research, and broaden the ability to answer more questions. We are limited by personnel. As you know, Julianne, you're run off your feet just as it is, and just having more resources would be able to expand our whole ability to do research.
Yes.
I do remember we talked a bit about just the whole technology side of things, creating apps to look at patient risk, taking a look at their flexibility, having an app that scores how knock-kneed or valgus are they, how stretchy are they, how weak in their core are they. We could add get an app going to assess ACL risk of injury and re-injury. We could have an app on selecting appropriate grafts for certain patients. As you know, our skier population, we use a different graft because they don't like their patellar tendons being used compared to our soccer players and our football players. And I think having a score in an app on that, those are all kinds of projects that we could facilitate in the future.
Yeah, that would certainly be amazing to be able to develop all those tools, and especially in terms of just elevating patient care and being able to deliver patient-centered care and personalize it for each patient would be amazing.
Yeah, and the wonderful thing about doing this through a foundation is the ability to freely share that knowledge, to freely share it across the country, North America, and the world for that matter. That's one of the beauties of the foundation model, is this isn't here's a business opportunity and let's see if we can make money. This would be more, no, let's share what we've learned and spread that knowledge. And the foundation model is so nice for that.
Why would someone want to support our foundation? What do you think the value is there?
Well, I look at my own personal experience, and I've had my own ACL reconstructed. My wife has had her ACL reconstructed. My daughter has had her patella stabilized. My son has had a meniscal repair. And so I realize the potential of these people around me, the people I love around me, and realize that we aren't 100% in our prevention, treatment, and rehabilitation of injury, and that supporting our programs will improve every generation's ability to stay moving forever. I would say that for me is the number one reason to support our cause is look at our youth potential and see if we can improve on prevention of injury, treatment of injury, rehabilitation of injury, and that education dissemination. The nice thing is we've kind of gone through our 20 years of growing pains. It took so long to set up the system. And with being a super collaborative team, we actually have the machine going. And that would be reason to support our group is because we are productive. We're publishing 10 plus papers a year in peer-reviewed journals. We are doing injury prevention programs virtually and in the community, return to ski programs. So the machine is running. And so support is, I think, good value to your dollar. I would say that is as a very truism. One of the things as I travel across the country and talk to people about their programs and talk to people about what they're doing is not only the collaboration from within our clinic. We work as a team. We have a lot of patients come through. Next available patient gets to be seen. Next available surgery spot gets to be seen. We're very collaborative, but also our partners. I want to mention how well we work with the Covenant Health and the Mineral Springs Hospital, and how, as opposed to putting up roadblocks of what we do, they are collaborative with us in can do. Let's get an intake clinic going. Let's integrate some physiotherapy in our assessment of patients. Over the last 30 years, that has been an important part, is how supportive our hospital has been with us. And I would say that also resonates out into the community. We have members of physiotherapists from almost all the clinics around us integrate into our follow-up clinics, into our intake clinics. And so again, it's the web of integration and the web of cooperation, and that over time is only expanding. When people comment on how siloed they feel in their institutions, in other centers in Canada, it's one of the things I'm most proud of is how integrated, collaborative we are as a whole team. It's an infectious culture to be positive, to do good work, to be collegial and collaborative. It actually makes going to work fun. And that's all part of it. I love what I do, and I think that goes down through the whole staff of not only our clinical side, but of the whole foundation side and our whole research side. They actually take a lot of passion and love in what they're doing. So the work is actually easy. It's not work when you love what you're doing.